everybody, Dr. Herman, the Guru Chiropractor and official Team Ringdinger, doctor of New Jersey, and I serve the Northeast of the US of A. Back again with another video. Peace and love to everybody out there with my newest patient, Miss Elizabeth, right? Liz, what'd you say it was okay to call you?
Liz.
Yeah, Miss Liz, coming all the way from
Pittsburgh, Pennsylvania.
Pittsburgh, Pennsylvania. 6 hours it took you? Yeah, we've taken that drive.
6 hours.
In fact, that table is from Pittsburgh.
Really?
Does it feel comfortable to you?
Mm-hmm.
Yeah, that's because it's from Pittsburgh. I got a good deal on it. Great table. That's the same table that Dr. Johnson uses, but I found one used, but I had to drive all the way to Pittsburgh to get it.
Nice.
I got a good deal on it. Anyway, I appreciate you coming all the way from Pittsburgh. The husband found out about the Ringdinger, and you were having problems, so he hooked it all up for you, right?
Yep.
And you guys took the ride.
Yep.
Let's say a little bit about what's going on with you. We already did the health history and a good exam. It's safe to treat. And you definitely have the condition that I feel very confident that I can help you with. Mm-hmm. There's definitely some compression in the lower back. So your main symptoms in general are you're just very stiff from the neck. It shoots down, and from the back it shoots up, you say.
Right.
In the whole spine, a lot of stiffness. And it's worse in the morning when you get up, right? But you're also having, I call them neurological symptoms. You're having some burning pain shooting down from your lower back into, let's see, the right calf, and then on both feet in the toes.
Right.
Frequently in the toes and occasionally in that calf area. Am I correct? Mm-hmm. Did I take my notes right? And it's been bothering you for about 3 months. Okay. But you also had a baby 15 months ago, we were talking,
Yes.
and they did an epidural. You had a C-section.
Yes.
And you felt things were not quite right down there ever since then. But the main symptoms didn't really happen for about a year after that.
Right.
But they're going on pretty consistently for the last 3 months. You've been to a chiropractor around town where you live. Yeah. And it gave you some good results, temporary, but you got some relief for the first couple. And then you went like, what, 3 or 4 or 5 times, right, Nala? And you said every time you go, after that, it's getting less and less recovery, less and less improvement. Right. Makes sense, right? Mm-hmm. Okay. And so you decided to come all the way here to get the Ringdinger, see if that'll make a difference.
Yep.
Okay. All right. Basically, that's it, right? For the symptoms, as far as the notes go. All right, so anything else you want to say? Anything else that I missed?
No.
You ready to go? You excited?
Yeah.
Good. All right, so let's go ahead and go face back down on this table. Get your body comfortable. And Nala's giving me a little bark and whine there. First thing I like to do on all my new patients is we're going to do a little massage first. Okay. Most patients love the massage. But if you don't like, let me know right away and I'll stop, or I'll ease up on the pressure. Once we're done warming you up with the massage, we're going to do a little loosening, a little warm up, get a little blood flowing. Then we're going to get you off this table and we're going to go straight in the back room where the Ringdinger table is, and we're going to get you set up on the Ringdinger table. Then you're going to get your first full spine decompression pull. Right, Nala? Show Nala to the fans out there. There's Nala here today in her new luxury apartment. I mean, crate. You okay with this? Does it cause any soreness when I'm doing the massage?
Nope, I'm good.
Good. Hey, shush. No whining in my office. You okay up here with this? Mm-hmm. Occasionally it gets too much. They feel like they get a little dizzy or something. So if anything like that happens, let me know. And if they complain of that, usually I say that's because you probably got a screw loose up there. And I'm joking. But if they're silent and they don't laugh, then I get nervous. I'm like, oh God, did I cross, you know, did I say too much? Good. Nice little warm up. Awesome. Okay, come on up from here. Go slow, no rush on my account. And we're going in the back room. Keep your hands up on your chest for me.
Like this?
Yeah, a little lower if you're good. Right there. Now I got to feel the top of your hip bones because we have to line you up on the table. You're way high up by about 6 inches. Slide your body down towards me. A little bit more. That works. All right, you just rest. Get comfortable. I got to set up the table. So we raise up the table first. Basically just to the height that I'm comfortable with. Now the table also is going to lift up your knees. Just let the table do the job. Try not to wiggle. Let it raise up your knees. Let them bend and relax as it comes up. I see the puppy paw. Is that a dog paw or a wolf paw?
They're bear paws.
Bear paws. Oh.
I meant to get them filled, and I wanted my my whole family's names on them.
Oh, there you go.
Then
So
I have a sunflower right here. Says Melanie Ann for my godmother.
oh, very nice.
She passed away in 2018.
Sorry to hear. Now we got to pin the hips down with these big pins. They're padded, but it's going to be a little tight. It's got to be snug. And what that does is it locks down your hips. So when I pull at your neck, your body doesn't slide. It kind of stops short. And that allows me to stretch and release the whole spine from the lower all the way to the top
Okay.
in one pull. You okay with that?
Mm-hmm.
Good.
Actually,
Now.
feels good.
Hands back to me. This is not the treatment. I'm just making sure you're pinned evenly and there's no slack. Yeah, you're good. All right, keep those here again, wherever you're comfortable. I have to get the towel going. The towel just gives me better grip because my hands are too small to grip your skull properly. Good. Lift up your neck. Come on down. Your job for safety, keep your teeth touching together, but don't bite hard. Just keep it closed. Okay? And do your best to keep the whole rest of your body as relaxed as you can be. Okay? You ready to go?
Mm-hmm.
So the first thing we do is I just get a good proper, hold on, let me get this hair out of the way. A good proper grip on the towel. And we're going to stretch out your spine first. So we're going to just do a little traction. So I'm just going to elongate and stretch it. Feel it opening up. Feel it stretching. Breathe through your nose. All the way down to the tailbone. Just let everything relax. And breathe. Oh my God, that was big. Breathe. Try to keep your body relaxed. That was loud. That was a loud one. Did you feel it all the way down? That's a good.
Woo.
That's a proper Ringdinger. That was one of the loudest ones I had all month.
Oh.
I think they heard that in Pittsburgh. That was a boom.
Probably.
People look around like, earthquake? Nah, just Elizabeth getting the Ringdinger
Yeah.
in central New Jersey. Was it
Right.
painful? You didn't seem like it was painful. Most people, they say no.
It just took me off guard. I was like, ah!
It's really hard to like explain to somebody what it's going to feel like. You just got to experience it, right?
Right.
But that was a very good, legit Ringdinger. Stay.
Oh, okay.
Because I want to feel your neck and possibly do a little more release before we get you up off this table.
Okay.
But I will have a few questions.
Yeah.
As you're laying here now, compared to before we did anything, does your body feel any different?
Kinda.
Yeah. Can you describe anything?
I feel more loose, definitely in the neck.
Okay.
I'm
Good.
still stiff in like the back.
You still
area.
feel stiff there?
Yeah.
As stiff? I'm not trying to pull out any good answers. I'm just trying to get a feel for where you're at right now.
A little bit.
A little bit. Okay. All right. Stay there. I want to feel your neck. We're going to do a little more twist probably to release more of the neck.
Okay.
Then we're going to get you up on your feet and then see how you feel standing. And then we'll walk a little bit and then we're going to go back on that table and I got much more to do over there.
Uh-huh.
So stay relaxed. Let it go.
Oh.
Good. Relax your neck. Drop it, drop it.
Oh.
Nice. Okay, can't say for the lower back yet because I can't feel it, but the neck feels great. Neck feels great.
Neck feels wonderful.
Okay, done here. So when you're ready, sit first, sit up, and make sure you're not dizzy once you're sitting. And if you're not dizzy, then you can get up on your feet. And once you stand, stop for a second and kind of feel, wiggle, bend, do whatever you need to do in your body to assess it, and then let us know if anything feels different yet.
That area.
Okay. Still bothers you is what you're saying. Mm-hmm. Okay. What feels different?
My neck and definitely my back a little bit.
Okay, good. All right, walk a little bit and see how that feels. And then when you feel ready, go back on this table, belly down where you were before. Okay. What I'm suspecting for the lower is it's more in your pelvis where you're jammed. Mm-hmm. The Ringdinger decompresses the spine, but not the pelvis. The pelvis is going to get released here right now after when you lay down on this table. So go ahead and lay back down.
Did you get pictures? Okay, get some more pictures, man.
Good. Now, remember when I bent up your knees and you said it was, ooh, ow, it was pulling? I'm going to redo that test like a midpoint check. Let me know if it feels the same as before or better or different. Oh, by the way, come here.
Yeah. You
tell me about that twist. If you might want to take your camera because you want to take another picture because that twist is gone. I want him to be my witness because you trust him.
It's absolutely gone.
Is it really?
That torque is completely gone in your hips.
You gotta take a picture.
I will.
Okay.
Well, after we're done, all the way. Bend here. Does that pull as much as it did the first time I bent it?
Not as much.
Still some?
Still some.
But reduced. Okay, good. That's usually what most successful patients tell me is it goes from right after the Ringdinger. It goes from something to reduced. But now we're going to release more here, a lot more. So slide down a little bit more. Right there. Good. Actually, raise up your face.
Yeah, I was kind of concerned because of...
Yeah. We'll get that in there. The belly part drops down, which is also for pregnant women. And this is going to pop up in a second. It's automatic. And I'm going to be doing some push down like that. Okay, so just stay relaxed. This is called the drop technique because your body drops down. Okay? Nice. Painful? Making noises. Just checking.
I'm good.
Good. Let it go.
Oh,
nice and crunchy.
Let me tell you, none of this came out whenever I went to the other chiropractor.
Raising back the belly up. Just by how your posture looks, I know you're already a lot better in here. Relax. Good. Let it go. Nice. I won't say that, but if Zach behind the camera wants to say that, relax. Good. Yeah. Yep. Okay, we're going to rebend again. I want you to tell me if there's been more improvement or not with the pulling.
It's still, there's a little bit right there. I don't know why it's doing that.
Okay, but question, is it improved and there's still a little bit hanging around, or is it about the same as the last time we bent it?
It's improved.
That's what I'm looking for. I'm looking for progress, not perfection on the first visit.
Okay.
We're looking for progress, though. I tell my patients, I'm a pretty good doctor, I'll admit it. This is an amazing technique, but I'm not Jesus. I don't perform miracles, sorry. So in other words, don't expect perfection after one treatment. Occasionally people feel that way, but don't expect it. But progress is what we're looking for. So we feel like you've made progress so far here?
Yep.
Perfect. Okay. Now let's see about the straight leg lift. Remember you lifted this one, it was pretty okay, but this one was halfway. So try this again. We'll do the left side. Lift that as high as you can. Don't bend. Good. And down. Now do the right side. Okay. What do you feel? Still a little jammed up in there?
Just right here.
Okay. What I want you to do is lay sideways, face me, all the way this way.
Okay. Which way?
That way.
Okay.
We're going to do a little twist on your hips, but
Okay.
mostly for the sacroiliac joint. Look this way. Bend this knee up, straighten the bottom. Now slide a little bit towards me.
Like that?
A little bit closer. Good.
Okay.
Now I have to roll you way towards me, and some people feel like you're going to roll right off the table, but you're not because I'm standing here.
Okay.
So do your best to stay relaxed. Don't guard up.
Okay.
Like people think, oh, he's going to drop me, and they get all tight. Relax it. Let it go. Good.
Oh.
Good. Do the same thing. Face the other way. Good. Twist.
Like this?
Yeah.
Okay.
Straighten. Then come a little closer. Good. Straighten. Okay. Look up at the sky. All right. Stay relaxed. Let it go. Good.
Oh.
Perfect. Big release. Go back on your belly when you're ready.
Okay.
Okay. Good. Feels a lot looser. Now we're going to work towards the middle and release more up this way. Do, 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 do. Relax. Let it go. Good. Good.
Oh.
By the way,
Yeah.
that bump that you had here is pretty flat right now. It's almost gone.
Oh my gosh, that's awesome.
So what that means is, I don't know till I measure it, but I'm highly suspecting, sorry.
You're good.
I'm highly suspecting, slide your body down towards me about an inch or two, right there.
Right here?
Yeah.
Okay.
My table is a little jammed, hold on. There we go. I'm highly suspecting that your neck is your head is way back over your shoulders. So we're gonna measure it at the end, but when this releases, that's what happens. Good. Relax. Good. Nice. Awesome. Awesome. All right, roll over on your back now, face up. How's it feel moving around, like as you just twisted around and moved your body?
Amazing.
You feel easier, like less jamming? Good. Let your legs come straight flat. Slide your body down about an inch towards your feet, right there. Now we're gonna do an ankle pull.
Okay.
It should release the ankle if it needs it, even more to the knee, even more up in the hip. You just give me a loose, floppy leg. I'll do the rest. Let it go. Oh, major. You okay getting your toes popped or no?
No.
That's why I ask. Let it go. Relax. Good. You want to do the knee pull?
Okay.
Yeah. Just drop the whole leg in my hands. Drop it in my hands. Be floppy. Let it go. Heavy. Drop it to the floor. Let it go. Drop.
I am.
Drop it in my hands. Loose. Heavy, heavy, heavy. Good. Now I'm just going to do a little yank. Stay loose.
Oh.
Nice. Do you feel that up in there?
Uh-huh.
Good. Scoot up a little bit.
Like.
Towards your head. Right there. Now we do the same thing on the other side. I just wanted to reset you. Drop it heavy. Let it go. Relax it. Good.
Oh.
Nice. Okay, since we skipped that other stuff, we're done for this table. So come on up again, see how you feel sitting up.
Oh, way better.
Yeah?
Way better.
Woo!
I'm not even kidding you.
That's awesome. Come on over here, sit on the stool again when you're ready.
Okay.
Have a seat, face it that way. Good. You told me the lower back when we were doing the health history interview was a 7 pain out of 10. What number would you say it is now since you got up a little bit?
Like 1 out of 10.
That's pretty good. I should ask because you okay if I adjust the elbow and the wrist? Or you want me to leave that too?
That's fine.
Okay. Out of everything, those are the least important, so it's
Right.
okay. All right, so then we're done with the session.
Yeah.
I want to check your forward head posture. So look forward, sit normal and straight. And then we're going to talk about a little bit about what to do when you go home, how to take care of yourself, what to do, what not to do for a couple days, and how do you know when to come back. No BS. It's about a 1/4 inch. So it went from like 1 1/4 inches to a 1/4 inch. So that's pretty good right now.
Thank
a
you.
lot flatter.
Thank
Do you feel looser here?
Yes.
So you did really well.
Thank you.
You're very welcome. Any questions?
Nope.
Okay. So here's what I want to say. You don't heal today. You heal after the visit. During the visit, you get released.
Right.
Your body's in a jammed up state and it can't unjam itself, which stops it from being able to heal and repair. That's why it doesn't resolve on its own.
Right.
We release that. I release that when you're here. Now the body has the ability to heal and repair somewhat more than it did before.
Right.
So you could have some symptoms involved with the healing process over the next 2 to 4 days.
Okay.
Sometimes something new pops up. Sometimes it just gets a little choppy and sometimes it doesn't. Sometimes it just slowly gets better over 2 or 3 days. I just give you all the scenarios so you don't get nervous if something happens and you're not expecting it.
Right.
Okay. What you want to do is not get in the way of the healing, which means try to take it a little easy for a couple days. Cut down on the yard work and the housework. You hear that? Don't make her clean for 2 days. She's got 2 days off. She's the one that wants to clean. You know, be careful when you're lifting the baby. I know you got to still carry the baby, but just be careful so you don't make a mistake or little jerky movements could put you right back out again.
Right.
And let it heal, and it will. So, and before you make a final decision or a final assessment on how this did for you, wait 2 or 3 days to let the healing happen.
Okay.
Then make a final assessment on yourself. If you feel like, yes, this made a huge difference, but I'm not all the way fixed, basically that means this is right treatment for you, but you might need 1 or 2 more. If you decide you want that, the best time to come back is in a week or 2. I know you guys got a really long trip, so I get it. Take that into consideration. Just get back as soon as you can. If you think you need more and you want more. And then we'll do more, and hopefully that'll push you further down the road of healing, okay? If you feel great and you don't feel like you need anything more, then there's no need to come back right away. And then if you ever feel you need another one of these, then come back then. Simple as that.
Right.
Okay? If soreness happens, which sometimes it does after the visit, ice will be helpful. I would put like some ice packs on any sore spots. I would avoid applied heat for like a day or 2 because if there's any swelling, heat makes things expand and you don't want to do heat on potential swelling because it makes it worse.
Right.
But cold makes things contract, so it's good for the swelling, it's good for the inflammation, and it's good for any pain too. It's a really good pain reliever. So it'll help calm things down faster than if you don't do the ice.
Okay.
Okay? Any other questions now?
Nope.
All right. Well, let's sign off and say goodbye. And then if you have any last minute questions while you're packing up, you can ask me that. Okay? So, Dr. Eric Herman, the Guru Chiropractor, peace and love to everybody out there. Miss Elizabeth went from a 7 to a 1, and her hips went from this to this. So based on everything, my impression, she's doing a heck of a lot better. Does that mean perfect? I don't know for sure. That's my honest answer, but better than she did walking in here. And I think in a really good, long-lasting way, I think this is going to really move you forward with your healing process.
Me too.
If you're watching this and you're relating and you're saying to yourself, God, I think I need some of this, or I know somebody that needs this, I would go with your instincts. But I'm saying for the people out there on the camera too, they were watching the videos. If you want to come to New Jersey, again, I have people, not a lot, but I have people driving 6 hours. I have people coming 9 hours. I have people coming, if you're, I'm the only doctor certified with the Ringdinger in New Jersey. There's one other guy in Manhattan and there's one guy in Massachusetts. So for the Northeast of the USA, it's me and 2 other guys. So if you need the Ringdinger and you don't want to fly in an airplane and you're in the Northeast and you're willing to come to Central New Jersey, I would be honored to help you. The best way to reach out and book an appointment with me is go to my website. It's probably on the screen here and down here somewhere, guruchiropractor.com, or you could text my assistant, Zach, directly at 908-224-3080. He will help you. He's highly trained. He'll answer any questions you have. We'll give you all the info you need to make a proper decision, whether this is right for you, and he'll help you get a good appointment, give you directions, and get you here safely and effectively. If you get here, my promise to you is, from my heart, God be my witness, I will do my very best to help you. I will give everything I have to give you the best results in healing that I could possibly help you with. Okay. God bless everybody. Peace out, love. Sayonara.